question number 1. In the lecture, you had just aligned facial scan with CBCT image. So are they all free software? And I also want to ask one more thing. Why did you align them all together when you're doing digital wax?
So first, let's talk about face scans. Face scans can range from free software on your phone that gives a model of the face. Sometimes it's a low poly count, sometimes it's a better count regarding the program that you are using. And then you can go forward and buy maybe hobbyistic object scanners, or maybe even scanners like the one from Funk that I'm using, or maybe the one from Ray, that actually give much better face scans. And with this data, you can actually build better smile design for the patient, because you can put the teeth on a position that is actually beneficial for the smile of this patient. And also, after you have the face in place and you are able to work on the smile of the patient, you will actually also need to work on the length of the crown. And to be able to do this, you need the position of the bone beneath the actual scans, and you merge the position of the bone and the roots and everything together, and you are able to now do crown lengthenings, or to plan maybe a Zucchelli technique, and everything is going to actually integrate, and you are also knowing if you have the bone, and with some programs you even can extract the pulp chamber, and you can see how to prepare the wax up so that you are not impinging even on the pulp chamber. So everything comes together in a nice big digital patient that is very beneficial for the planning in the end.
With the CBCT data, you can see the root angulation or flange or the bone resorption and things. So these are very helpful for doing digital wax. That's what you mean?
Exactly. It's very beneficial to see where the roots are, to know where the bone starts, because when you open a flap to do a crown lengthening, you will want to know if you just cut the gingiva or you are going to actually do also some bone remodeling. So this is helpful. Then with the roots, you also can go with an orthodontics case, and to know how to displace the teeth, to put them in a proper position, to then do the planning and continue with the prosthetic phase.
But in your lecture, the case was just for the full mouth rehabilitation, or ortho, or what was it about?
No, ortho was not planned in this case, but merging the actual crowns with the roots is very helpful for orthodontists as well. So it's a technique that you can use on any case you need when it goes to ortho, for example, for aligners.
Okay. Okay, so let's move on to question number 2. Question number 2, can we make a custom teeth library with Medit Design? If yes, can you explain the whole process about it?
Yeah, so my workflow here is to actually go to ExoCAD and plan a full arch of teeth, and I'm using their full anatomic libraries, any library I need, and I just put it outside the arch. Then I export every tooth from the library and bring it in Medit Design. And Medit Design offers a custom base, and you place the custom base in contact with those teeth that you just imported. You Boolean merge it together, and now that you have a base with the teeth from Exo, you can go further, because Medit Design does not export in the library format of Medit Clinic Cad. You take this base with the teeth, with the new teeth, and go to the orthodontics program of Medit Ortho, and there you can extract all teeth with open bases. This is very important. And now Medit Ortho actually exports these teeth that you actually took from another library in a format that Medit Clinic Cad can use. And now you have the library of this said ExoCAD case in Medit. You just need to do it once to have the whole library there. So I encourage you to do this. Every library that you actually like, you're going to do this protocol one time, and then you will be able to use it as many times as you like.
For me, it seems quite complicated. So can't we just design from the Medit Design?
We can design in Medit Design, we can take teeth in from another library and we can use them there. But then we are going to need to do some things in the end. For example, after you place the teeth, you'll not be able to place connectors. So you'll just have the teeth there. To be able to then do intersections, you're going to need to cut the teeth to the gingiva and to the proximal points with the model you have. And then occlusion is also going to be able to be possible there by cutting the teeth to the antagonist. Antagonist cuts the teeth that you just placed in. But the problem is you'll need to do in Medit Design, you'll need to do the connectors by hand. To place connectors by hand, this is a little harder. So maybe it would be better to just use a library like this, like we've talked, to build the position of the teeth, to do all the cut intersections and place the connectors, and just then come to Medit Design and do your modifications there.
Okay. I think there will be so many people thinking like me. So your answer, I think, will be really helpful.
I hope so.
Yeah.
Also, these ways of working are already presented in the webinar. So you'll see there how you can do an occlusal cut, or how you can adapt a tooth to the underlying base.
Okay. Okay, last question. Question number 3. Is a Smile Design app helpful when doing digital workshop with Medit Clinic Cad, or do you just use it for diagnostic purpose and explaining about the patient?
So it's very helpful, but because when you do this Smile Design in the Medit app, in the Medit Smile Design app, you actually get values from them. And after you get the values of the length of the teeth and the width of the teeth, you are going to go to Medit Design. And as I showed you in the webinar, you place a grid over the teeth you are working on. And now, because you have the values from Smile Design, you are going to be able to adapt the teeth that you are working on with the grid. For example, if you have 5 millimeters of width for a tooth, you're just going to use the grid to get it from that set viewing point to that 5 millimeter with the grid, because every square is 1 millimeter. So it's going to be easy to adapt the teeth you already have by the grid that overlays.
Okay, so what is grid? Grid?
The grid is actually a tool in Medit Design on the right of the program, where many squares, lines, vertical and horizontal, are overlaid over the face and over the teeth of the patient. And these squares that you see there actually have a very clear amount of millimeters. Every square is 1 millimeter. So you will know how big an object is beneath this square, and you are going to be able to adapt the teeth from left to right to always see that you have the same dimensions on both sides.
Okay. Thank you for answering.
My pleasure.
Okay, that was all about it for today.
It was such a great pleasure and honor to be here and continue these webinars, and I hope to see you all next time.
Okay, so you'll be able to watch this webinar on our YouTube channel and Medit Academy. Thank you for being here, Dr. Bogdan.
My pleasure. Bye, guys.
Bye.
Bye.